Perubahan yang berjalan pesat pada era teknologi modern saat ini mendorong tumbuhnya inovasi yang seolah tak terbatas. Universitas Kristen Duta Wacana menjadikan perubahan tersebut sebagai tantangan yang harus dihadapi bersama. Oleh karenanya, diperlukan kolaborasi yang sinergis dengan berpijak pada nilai-nilai Duta Wacana untuk menjadikan Universitas Kristen Duta Wacana semakin unggul dan tangguh.
Inklusif berarti aksesibilitas bagi lebih banyak orang. Inklusif berarti penghormatan pada hak asasi manusia. Inklusif berarti perayaan aktualisasi diri bagi setiap individu. Selangkah demi selangkah, komitmen pada inklusif dan aksesibilitas ditunjukkan dengan kolaborasi multidisiplin oleh seluruh sivitas akademika UKDW, baik dosen dan mahasiswa, bekerja sama dengan para mitra industri, pemerintah, LSM, dan masyarakat. Saat ini perhatian bahkan juga ditunjukkan dalam rintisan layanan disabilitas kampus dan pusat studi.
Penyediaan rumah ibadah bagi Islam, Kristen, dan Hindu merupakan komitmen UKDW untuk inklusivitas beribadah. Interaksi sosial antar mahasiswa di dalam kampus merupakan ruang dialog yang memungkinkan inklusivitas beragama terjadi.
Saya bersyukur menjadi bagian dari keluarga UKDW. UKDW menjadi tempat bagi saya untuk tidak hanya menjadi pintar, tetapi juga mampu mengolah rasa, menerima keberagaman, dan merayakannya bersama-sama.
Dilaksanakan di Kompleks Universitas Kristen Duta Wacana, terutama Gedung Logos lantai 2 sampai dengan lantai 7.
Fakultas Kedokteran Universitas Kristen Duta Wacana memiliki visi menjadi salah satu fakultas kedokteran yang unggul, yang menghasilkan generasi dokter yang berbudi luhur, profesional, mandiri.
Yogyakarta, kota yang dikenal sebagai kota pelajar dan budaya. Pada tahun 2009, UKDW mendapatkan izin pendirian program studi pendidikan dokter. Dan pada tahun 2011 diresmikan menjadi Fakultas Kedokteran. Aktivitas pembelajaran dilaksanakan di Kompleks Universitas Kristen Duta Wacana, terutama Gedung Logos lantai 2 sampai dengan lantai 7.
Fakultas Kedokteran Universitas Kristen Duta Wacana memiliki visi menjadi salah satu fakultas kedokteran yang unggul, yang menghasilkan generasi dokter yang berbudi luhur, profesional, mandiri, dan terpercaya dalam bidang pelayanan kesehatan untuk masyarakat yang pluralistik berdasarkan kasih. Visi tersebut diterjemahkan ke dalam 5 misi. Misi yang pertama adalah menyelenggarakan pendidikan dan pengajaran dalam bidang kedokteran untuk menghasilkan generasi dokter yang profesional, mandiri, dan terpercaya. Misi kedua adalah melaksanakan riset dan menerapkan hasil riset kedokteran agar tercipta dan terbina sivitas akademika kedokteran yang unggul dalam inovasi dan diseminasi ilmu pengetahuan dan teknologi kedokteran. Misi ketiga, melaksanakan kegiatan pengabdian dalam bidang kesehatan untuk masyarakat yang pluralistik berdasarkan kasih. Misi keempat adalah membangun institusi yang unggul dan kompetitif menuju Medico-Preneurial Faculty. Misi kelima, mengembangkan sivitas akademika yang mengacu pada nilai-nilai kedutawacanaan, nilai moral spiritual, dan etika profesional.
Untuk mencapai tujuan pembentukan Fakultas Kedokteran sesuai dengan visi dan misi fakultas, kami menyusun kurikulum yang diperbarui setiap 4 tahun dan mendukung implementasinya dengan sumber daya manusia, sumber daya alat, sumber daya informasi, dan ruang pembelajaran yang memadai. Memenuhi kebutuhan administrasi pendidikan seperti registrasi, pengurusan praktikum lapangan, maupun skripsi, pegawai pendukung akademik siap melayani mahasiswa dengan sigap. Fasilitas sumber daya alat dan ruangan tersedia untuk mendukung pembelajaran. 6 ruangan laboratorium biomedis meliputi anatomi, histologi, fisiologi, farmakologi, biokimia, patologi anatomi, patologi klinik, mikrobiologi, dan parasitologi. Ruangan tutorial, sejumlah 10 ruangan, terletak di Gedung Makarios. Laboratorium keterampilan medik tersedia di Gedung Logos lantai 6 dan 7. Untuk mendukung sinergitas, rapat persiapan blok dan semester dilakukan oleh penanggung jawab blok, dosen ahli, dan para tutor diskusi. Kuliah pakar dilaksanakan untuk memberikan wawasan bagi mahasiswa, diberikan oleh para ahli di bidangnya. Ribuan koleksi buku dan jurnal online disediakan untuk pembelajaran mandiri para mahasiswa. Ruang diskusi dapat digunakan untuk pembelajaran berkelompok di luar jadwal. Pembelajaran di laboratorium biomedik dilengkapi dengan koleksi preparat anatomi, puluhan mikroskop cahaya, dan ratusan slide preparat, koleksi biobank bakteri dan parasit, serta berbagai protokol biokimia dan patologi klinik yang akan meningkatkan pemahaman mahasiswa terkait materi blok. Dalam evaluasi pembelajaran tiap blok dan beberapa kegiatan praktikum teknologi informasi, disediakan lebih dari 70 unit komputer yang dapat digunakan oleh mahasiswa. Pembelajaran laboratorium keterampilan medik saat ini dilengkapi dengan lebih dari 200 manekin dan berbagai instrumen medis sebagai media praktik. Selain aktivitas akademik, mahasiswa didukung untuk mengikuti kompetisi dan organisasi. Sampai tahun 2019, Fakultas Kedokteran telah meluluskan lebih dari 200 dokter dalam 13 periode sumpah dokter. Lulusan Fakultas Kedokteran tersebar di berbagai rumah sakit, menempuh studi lanjut magister maupun pendidikan spesialis. Sebagai pengabdian terhadap masyarakat, setiap tahun Fakultas Kedokteran bekerja sama dengan beberapa kolaborator mengadakan operasi katarak gratis dan pendampingan di beberapa desa binaan di daerah Kabupaten Bantul. Berbagai kegiatan tersebut, baik akademis, laboratoris, praktik, sosial kemasyarakatan, akan membentuk lulusan Fakultas Kedokteran, yaitu menjadi dokter profesional mandiri bagi dunia pluralistik berdasarkan kasih.
Assalamualaikum warahmatullahi wabarakatuh. Shalom, Om Swastiastu, Namo Buddhaya, Salam Kebajikan. Ladies and gentlemen, good afternoon. We would like to extend our warm welcome to all webinar participants. We are pleased to have you join us as we engage in this session hosted by DUTA WACANA Christian University, Faculty of Medicine. Today, we gather virtually for a scientific seminar on biomedical informatics to support public health advocacy. The seminar is the part of the 15th anniversary of Faculty of Medicine DUTA WACANA Christian University. I am Dr. Lori Priscilla, and I will be hosting and moderating this afternoon webinar. Before we start the webinar, please join me in a brief prayer for its success. Let's pray together. Thank you. Ladies and gentlemen, in honor of our nation and its values, please rise and join me in singing the Indonesian national anthem, Indonesia Raya. Over the next 2 hours, we will follow a structured webinar with specific rules to ensure a smooth and productive session. First, participants are asked to turn off the microphone during the webinar unless the moderator asks them to turn it on during the question and answer session. Participants are requested not to disrupt the webinar by scribbling on the screen, making noise by turning on the microphone, or taking other action that interfere the session. Participants who want to ask a question can write in the available chat box with the format name-institution-speaker-question. Please fill in the attendance given via link, listed in the chat column at the end of the event. Attendance will prove your presence. We hope that all participants can follow the webinar to the end. This afternoon, Dr. De Maria Mewati Widakdo, PhD, the Dean of Faculty of Medicine of DUTA WACANA Christian University, is pleased to welcome the presence of all of you in this webinar. For that, let's listen to the opening remarks from the Dean of Faculty of Medicine of DUTA WACANA Christian University. To Dr. De Maria Mewati Widakdo, PhD, the time and screen is yours.
Thank you, Dr. Lowry. Good afternoon. Warm welcome to everyone joining us today for this special webinar. This webinar is held as part of our 15th anniversary celebration of the Faculty of Medicine, Universitas Kristen Duta Wacana in Yogyakarta, Indonesia. We thank God for His grace and blessings that our Faculty of Medicine, Universitas Kristen Duta Wacana, has been able to deliver medical education for 15 years. It's maybe relatively young, but we are thankful for God's grace that we have been able to exist for 15 years, and we will continue delivering medical education for many years to come. We are thrilled. Today, we have you to join us for this important discussion on biomedical informatics to support public health policy advocacy. We are honored to have two distinguished speakers with us today. First, I would like to thank Professor Amelicia Yusu from the National Yang Ming Chiao Tung University, Institute of Biomedical Informatics. I hope I have pronounced it correctly.
Yeah, very
Thank
well.
you, Prof. Emily. Thank you for your
It's my honor.
sharing your time with us. Prof. Emily is a leading expert in biomedical informatics, whose work has significantly advanced the use of data to improve public health outcomes. And we would like to learn a lot from you.
Sure, no problem. Thank
you. Joining her is Dr. Dania Crispinanto Aditya Nugroho, our own lecturer, who is currently doing and finishing his PhD study at Taipei Medical University in Taiwan. Thank you, Dr. Daniel. He is a passionate advocate in public health policy who leverages data-driven insights to develop effective and equitable health policies. We understand that data is a very strong, we call it weapon, or we call it as a means, to improve, to keep improving our health policy, to also increase the health status of Indonesian people. Today's session will explore how biomedical informatics can empower public health policy advocacy, addressing health challenges with innovative and, of course, data-driven solutions. Because now even the Indonesian government has recognized that policy should be developed based on evidence, or it should be data-driven. There should be data as basis for the development of policy, and we have to keep learning and empowering ourselves with data informatics. Thank you to our speakers, our organizing team, and all of you for being here. Let's make the most of this opportunity to learn. God bless you all. Thank you. Back to you, Dr. Lowry.
Thank you, Dr. Maria Mewati Widakdu, PhD, for delivering the remarks. Okay, without waiting any longer, let's enter the first session of this afternoon webinar entitled Basic and Main Components of Public Health Informatics Infrastructure and Strategy and Technologies for Building and Developing Effective Health Informatics Systems. Our first speaker is esteemed Professor Emily Chia Yusu from National Yang Ming Chiao Tung University, Institute of Biomedical Informatics. Her extensive experience and knowledge in the field make her an excellent guide for our webinar. Professor Emily Chia Yusu has completed her undergraduate program in National Taiwan Normal University. She then continued her master's studies at National Taiwan University and subsequently complete her doctoral program at National Chiao Tung University. She is currently a professor in National Yang Ming Chiao Tung University, Institute of Biomedical Informatics. She also active participates in research on medical informatics, machine learning, clinical decision support, structural bioinformatics, and also proteomics. Her recent paper is about improving dengue fever prediction in Taiwan and also symptom-based scoring technique by machine learning to predict COVID-19. Well, now we connect with Professor Emily. Hello, Professor Emily, how are you?
Hi, Dr. Lowry. It's my pleasure and honor to be able to give a talk here on this webinar. Yeah,
Yeah.
it's very exciting.
Yeah, it's really honored to see you here, Professor. Okay, to Professor Emily, we welcome you to able to present the first and second material. The time and screen is yours.
Thanks a lot. Let me share my screen first. Okay, now can you see my slides?
Yes, we can, Prof. Emily. Thank you.
Okay. Okay, so I got 40 minutes for my section, and I divided into two different sections. So in the first part, I would like to share with you my experience from Taiwan about the fundamentals and key components of public health informatics. So this is the title of my talk today. I'm from Taiwan. Recently, starting from August, I shifted to National Yangming Jiao Tong University, which is a public school in Taiwan. Before that, I was a professor at the Taipei Medical University for like 15 years. And it's my honor today to share my research and my experience to you in this webinar. So this is my outline for today. First of all, I will briefly introduce health informatics and its applications. Then I will divide my talk into three parts, starting from the most basic research, how to apply health informatics techniques in bioinformatics. After that, I will move on to how to use health informatics technique in medical informatics. And finally, for the second section, I'm going to introduce what are our research outcome for the info epidemiology. That's the new part. Okay, so for the first part, I got my bachelor's degree from National Taiwan Normal University. After that, I went to National Taiwan University to pursue my master's degree in computer science. At that time, I work on natural language processing technique. After that, I study in Academia Sinica, which is a research institute in Taiwan. At that time, I used machine learning technique to analyze bioinformatics research. Especially, I work on protein sequence analysis mostly to predict the function and structure of proteins. Oh, how to make it go away? Let me see. Hi. Okay. Is it better? Yeah. Okay. Okay. So after I graduate from my PhD, I work as a postdoctoral fellow in Academia Sinica, which is a research institute in Taiwan. And after that, I joined as a professor at Taipei Medical University. Besides that, I also joined Taiwan Association for Medical Informatics and work as the secretary in general and have been a supervisor. And now I work as a professor at National Yangming Jiao Tong University. Besides that, I'm also a current active director of Taiwan Association for Medical Informatics. So I think it's a good fit for me to share my experience here. So before I get started, I would like to briefly introduce when we talk about health informatics or informatics. Nowadays, not only in Taiwan, but also in many other countries in the world, many people use artificial intelligence, especially the application of machine learning to predict medical informatics related topics. So here we can see that when we talk about machine learning or data mining, which is a very important application in health informatics, usually we will integrate three aspects, including like a statistical analysis technique, and then we incorporate machine learning algorithms. Besides that, if we work on really huge data, for example, like in Taiwan, we have the National Health Insurance data set, and also in Indonesia, we also work with a researcher in Indonesia to analyze your national health insurance database. So we need to integrate different aspects of research to be able to propose good strategies for health informatics. So during the journey of changing data into information, it is called the knowledge discovery process. We usually collect raw data not only from the hospital, but also maybe from the internet to analyze epidemiology. After that, we need to do data pre-processing to clean up the data. For example, we may perform like a feature selection, dimension reduction. If the data is not suitable, we may perform normalization or sampling. After that, we use the data into machine learning technique, or we use data mining strategies to extract important information from the data. After that, if we can do post-processing, for example, we can filter patterns from our data and probably provide a good visualization of the data. Besides that, if we can interpret our findings more, it will make the other people or the readers of your paper to know what's the collected raw data, and based on your approach, what did you get from this analysis or this study? So we call it information. The process of converting data into information is called knowledge discovery. Later, I'm going to show you some of my research results to demonstrate how to do health informatics or how to use machine learning technique to find out important questions in the field of health informatics. Okay, so before I move on to several examples, I would like to talk generally about the applications of especially machine learning in the field of health informatics. For example, for clinical decision support, we may use machine learning technique to identify disease or identify a diagnosis. What would be the better treatment for a certain patient? So this is related to precision medicine or so-called personalized medicine. Besides that, for drug discovery, we may want to use machine learning to narrow down the possible drug candidates so that we can save more money and time for drug discovery. Besides that, nowadays, medical imaging processing is very important. We may use medical image processing technique to analyze or to identify important regions from a medical image. For example, like X-ray, CT, MRI. Those are very important applications that we can help in the field of health informatics. Besides that, for EHR, electronic health record, nowadays, people in Taiwan start to collect data from the hospital, including EHR and also the lab examination data and also image data to integrate together to become a large clinical research database for researchers to use. Yeah, besides the insurance data. Finally, in the last part of my talk today, I'm going to share with you our experience more related to the public health, especially about the COVID outbreak prediction. So in summary, today I'm going to share with you some experience in Taiwan in terms of using health informatics in the molecule level, which I'm going to talk about a little bit about bioinformatics. Besides that, in the second level, when we talk about an individual patient level, I will briefly talk about how machine learning or artificial intelligence can help in the field of medical informatics. Finally, in section 2, I'm going to focus on the population level to introduce what are the techniques that we can learn or we can use to analyze public health informatics. So health informatics is a big research topic. I'm going to divide into these 3 different parts and share some experience from Taiwan to you. So next part, I'm going to get into the first part, how to apply health informatics techniques in the field of basic research. So since my research topic focus on the proteomics, especially the analysis of protein sequence. So I will use some example from the protein analysis part to demonstrate how to use health informatics techniques, especially machine learning algorithms to analyze the basic research from the molecular level. Okay, I know it could be a little bit difficult for people here on the webinar, so I'm going to go through very quickly just to demonstrate that health informatics technique can also be used to identify important findings from bioinformatics. Okay, so this is a gram-negative bacteria. We know a cell, it has different compartment or so-called subcellular localization, including the cytoplasm, outer space outside of the cell. And for this kind of bacteria, it got 2 layers. One is called the inner membrane. The other one is called the outer membrane. In between, the compartment is called periplasm. So there are 5 different localizations. And usually, the biologists need to do experiments to be able to know what is the localization or the compartment of the protein in a cell. But with the help of machine learning technique, we can develop bioinformatics approach to analyze only the protein sequence without doing any wet lab experiment. We can guess or predict where will the protein go inside the cell. So here we propose 2 different approach. One is based on more biological knowledge. The other one is based on more computational technique. So over here, our first study make use of the bacterial secretory pathway. We saw this pathway from a science paper, and it gave us an intuition that we can use different features to predict protein in different localization. Therefore, we use solvent accessibility, signal peptide, transmembrane alpha helix, and other biological features to predict the location of the protein. Besides that, we also propose a new algorithm in which different classifiers use different set of features to predict different localization. So this is the architecture of our study. Given a protein sequence, we extract different kind of biological features from only the sequence. After that, we propose different machine learning techniques to predict the localization of the protein. So here it is our performance. PSO 101 is our approach. Compared to the other state-of-the-art approach, our approach performs better than the others. So this is the first way to use more biological features to predict the location of a protein. Here I would like to share with you that we can also use another kind of thinking to treat protein sequence as a document with 20 amino acids as the letter. You know, in English, we got the 26 letters, but here in the document of protein, we got 20 amino acids. We can treat it as 20 letters. So here we propose a new approach to first identify the keyword in the protein document. We use a dipeptide composed by 2 amino acids. So here we use evolutionary information to score those keywords in the protein, and then we use feature reduction technique to reduce the features, and then we propose this architecture. Also, given a protein sequence, we score the features, and after that, we combine the features into machine learning algorithms. And finally, we can also predict the localization of the protein. So this approach called PSL-Doc means based on document classification technique. This one also performs better than the other state-of-the-art results. So over here, we can also propose a better visualization of the patterns in terms of the 5 different localizations. So we also apply our approach to other techniques, other prediction studies. For example, how to identify allergens from proteins like crab, shrimp, or kiwi. We can identify the allergic proteins from those kind of source. Besides that, we also apply our approach to identify important antigen antibody interaction from immunology. Okay, so let's the brief introduction of the application of health informatics or machine learning techniques in bioinformatics. Okay, so I know that the first part could be more basic, and next part I'm going to move on to the individual patient level application. Here, I'm going to begin the introduction of medical informatics or application of machine learning in health informatics. So starting from the second part, I'm going to focus on the individual patient level, which that our audience may be easier to imagine, or maybe you have a similar experience in this kind of study. Okay, so for the second part, I'm going to move on to the individual patient level. Health informatics techniques can also be applied in medical informatics to treat or to help patient level analysis. Okay, so there are many applications and a lot of experience, not only in Taiwan, but all over the world. But due to the time limitation, I'm going to share with you some of the applications or the experience from my research group. The first part is that we know diabetics is a very common disease, not only in Taiwan, but also all over the world. For diabetic patient, one of the most important part that the patient need to pay attention to is the eye problem. For example, here I talk about how to predict the diabetic retinopathy problem based on the clinical data of the patient. So here we propose a study to collect data from the patient, and here we use a different kind of machine learning algorithm to predict who are the patients that tend to have retinopathy problem during his life. So we publish our study in BMC Bioinformatics Journal, and besides the predictive performance, which is important, we need to have an accurate prediction performance to tell the patient that our prediction model is reliable. But most important of all, during my collaboration with medical doctors in Taiwan, they are also interested to know the reason or the knowledge behind this prediction. Okay, so here I'm going to share with you, if you want to know, or if your family or friends who also has diabetics, then according to our analysis, the most important factor is to look at whether this patient already used insulin as his or her treatment or not. If insulin already been used during the treatment, we go to this yes part. This is a decision tree, easy to visualize and easy to understand, so that we can propose an interpretable machine learning prediction. Not only just a black box, we can know the reason why this patient, this diabetic patient, will be predicted as those who tend to have retinopathy problem. So if he or she already used insulin, then the probability or the risk of having retinopathy problem increase. It's very likely to have retinopathy problem. So if this patient has not used insulin yet, didn't use insulin, then we further look at the duration of year that this patient got diabetics. If the duration of year is more than 7.5 years, then according to our prediction model, this patient is likely to have eye retinopathy problem. But if it is still less than 7.5 years, then it's okay. Maybe the risk is not that high. So here, from this diabetics retinopathy prediction result, I would like to share with you. Nowadays, not only a very high predictive performance result is important, but also people in Taiwan start to focus on how to develop an interpretable machine learning result so that you can let the medical doctor know why the reason this patient may be diagnosed as having retinopathy problem in the future, but also you can explain to the patient themselves for them to understand better. So I think interpretable machine learning is a very important concept nowadays in health informatics research. The next example I'm going to share with you is in Taiwan. Many people, but not only in Taiwan, but all over the other countries, came to Taiwan to have IVF treatment to help couples that want to have baby, but they cannot have baby in the natural way. Here, many people came to Taiwan to have IVF treatment so that they can get success pregnancy after the treatment. So therefore, in Taiwan, we got a lot of data from IVF, and we collected 17,000 data from our database. And after that, we divide our data into different partition, and we use both logistic regression and machine learning to predict who are the female patients that tend to have success pregnancy after their IVF treatment. For those who cannot be pregnant, what could be the possible reason? So we publish our study on PLOS ONE, and it becomes a very popular article on the journal. So for the variables, we use the cause of infertility, the ART method, or the source of sperm and egg, and whether the egg is fresh or frozen. And also the other treatment-related variables, for example, like ovarian stimulation protocol, duration of infertility, and many others. So these are the clinical variables that we collected, and hopefully we can predict IVF pregnancy success rate with a very high accuracy. So this is our machine learning result. We can see that this is called ROC curve. If we got a higher area under the curve, AUC, it means that our prediction model performs better. Besides that, I also talk about interpretable AI is a very important issue nowadays. Therefore, we try to propose what would be the important variables related to IVF pregnancy success rate. We can see like ovarian stimulation protocol, total frozen embryo numbers, and most important of all, female age is a very critical issue in the treatment of IVF. Besides that, we want to further know the reason why this female can or cannot get a success pregnancy in IVF treatment. Interestingly, we can see that from this figure, the female age is a very, very important factor related to the success rate of IVF. This line here, it indicates that if this line is below 0, then the success rate of having a pregnancy is difficult, is very low. If it is greater than 0, it means that, it is easier to have a pregnancy success rate in IVF. So we can see this line crossed at the age of 38, 39. This indicates that from our machine learning analysis, it suggests that for female age over 38 or 39, it is difficult to have success pregnancy in IVF. Okay. So besides that, the other interesting finding that we observed from our machine learning analysis is that during the treatment of IVF, there are two kinds of eggs source. For example, the egg from the mother could be frozen like several years ago when she are not sure whether she want to get married or have baby. She had her egg frozen somewhere. Okay, so that is called a frozen egg. The other is fresh eggs. So before I do this analysis, I will intuitively assume that, oh, I think fresh eggs could be better for the IVF pregnancy success rate because it's fresh. However, if you look at our analysis, you can see that the result above 0 indicates easier for pregnancy. This fresh, surprisingly, it is below 0, which means that fresh eggs are not good for pregnancy success rate. Okay, so it's a very interesting finding. So this means that if you can interpret your finding from the analysis of health informatics, it would be very interesting and it will provide useful suggestions for other patients in the future. So here we do some literature review and found that the other people also reported that frozen eggs is better for the pregnancy rate because the eggs were frozen when the patient was younger. When we use fresh eggs, maybe the mother decided to do IVF after her 40s or even in 45. It means that fresh cycle is got a bad quality for the eggs. Okay, so it is a very interesting finding, and at the end, it does not fit our intuition at the beginning. Okay, and the other finding about the age, one of the previous study also reported that age can also be considered one of the most important factor related to the pregnancy outcome during the IVF treatment. Okay, so this suggests that our computational finding correspond very well with the biomedical knowledge. Okay, so that is based on the clinical data to predict the pregnancy success rate in IVF. Nowadays, people also focus on the quality or the examination of the baby before he or she was born. So here we also work on pre-implementation genetic screening called the PGS. Before we put the embryo into the womb of the mother, we will perform a PGS examination to see whether the embryo is healthy or not. In Taiwan, doing this kind of examination costs a lot in Taiwan dollar. Therefore, we try to propose a cheaper, a faster, a more efficient way to use image processing to analyze whether this embryo is healthy or not. So here we propose a deep learning algorithm to analyze the embryo image and be able to predict whether it is healthy or not. But since this kind of examination is quite expensive, therefore we didn't get as many data as the previous IVF clinical data. So our prediction performance achieved around 70% in accuracy. For this study, I think we still have room for improvement. But here, I just want to show that health informatics technique can not only be applied on the database or the clinical data, but can also be used to perform image processing. For example, here I used the image from the PGS examination. Okay. So for this study, finally, I would like to share with you, publishing good paper is one of the way to get promoted for PIs and to get be able to graduate for students. But that's not the end of our research purpose. I think the most important part is to make use of your research finding and be able to propose some way to be used in clinical practice. Therefore, we construct a website and an app for female patients who try to get pregnant during the IVF treatment and be able to help them to analyze their pregnancy success rate during the treatment. And hopefully, we can also suggest possible directions to help them during this process. For example, if you are overweight, maybe you need to first reduce your weight a little bit so that it would be easier to have a pregnancy success rate during the treatment of IVF. Besides that, we also submitted a patent application and also got accepted in Taiwan. So the end of our purpose of doing research is not only publishing paper, but also propose something useful that can facilitate the clinical practice. Okay. So besides that, I think our analysis can also be used to analyze like text data. Nowadays, text mining is also a very important aspect in the field of health informatics. Here, we collaborate with a medical doctor in the hospital and be able to use medical record summary and along with our natural language processing technique to extract important information from the written record from for the psychiatry patient. So you can see that this is one example of our psychiatric evaluation form, and our goal is to find out who would be the patient who tend to have, for example, like a violent behavior. If we know that, or if we can predict that, maybe we can come up with some kind of measure to prevent him or her from hurting himself or hurting other people. So this is our text mining result. We try to find out what would be the association between violent behaviors and other factors. So it is interesting to observe, for example, if the gender is male and he is under financial stress, then it is very possible we have a high confidence that he may develop some kind of violent behavior. Besides that, if the gender is male and the history of inpatient treatment is yes, or it is also possible that this patient may develop violent behavior. So nowadays, in the field of medical informatics, it is not only want to develop a prediction model with a very high predictive performance. But also, I repeatedly emphasize that an interpretable model would be very important, especially when we talk about our clinical practice, or what would be the strategies for our government to incorporate in the future. Interpretable result would be very important. Okay, so besides that, we also do mining from here. Okay, is my time up for the first section?
Yes.
Okay, okay, yeah. I'm finished the first part for the slide. So thank you. So I will stop here and then move on to the other part, or stop here.
Sorry, Professor Emily. This for the first and second session.
Okay. So I will stop sharing and take some questions.
Yeah.
Okay.
Okay. Thank you, Professor Emily, for delivering a very interesting material and, of course, making the webinar participant even more curious about public health informatics and bioinformatics. Now we are moved to the discussion session for the first speaker. So please, the ladies and gentlemen, I remind you to be able to submit question in the chat column available. Please provide the question with format name, this institution, the speaker, this question. Okay. The first question. Okay, there is several question that are already given to us. Neither is from the Zoom and also the YouTube channel.
Sure. So
let me read it for you.
Thanks a lot.
At first, what methods that can be used to educate healthcare providers on interpreting and utilizing genetic data in clinical decision making? Maybe, yeah, okay.
Okay. I think it's a pretty good question related to the analysis of molecular level data. So the question is about how to evaluate and interpret the utilization of genetic data in clinical decision making. I think, of course, when we talk about the application of AI in biomedicine, we need to first, like what I demonstrated, the prediction or the analysis is reliable. So usually for the computational part, we will use measures, for example, like accuracy, or you may have heard like sensitivity, specificity, what would be the false positive rate, false negative rate, and maybe we will use like a ROC curve, area under the curve. Those evaluations measures were very common in the computational analysis part to evaluate whether we can provide this kind of result on human or not. Besides that, for the clinical part, of course, we need to have the clinical trial or to see whether this work on patients in the clinical practice. That would be the second part. We really apply our findings on the patients, and we can use a trial to demonstrate the efficacy or the effect of our finding. Okay, so that would be the answer to the first question. I'm not sure, is this the answer that you expected?
Okay, thank you, Professor Emily. It's a really great answer. Okay, maybe we move to the next question. What is the ethical consideration should be taken into the account when collecting the patient data, especially in electronic health record for the machine learning models in healthcare?
Okay, thank you, Dr. Lori. For the second question, it is a very important and critical question before we can actually do any research on the clinical data. So due to the time limitation, I didn't explain very clearly, but actually for every study, every data we collected from the hospital, we need to go through the application of IRB to get the approval from the committee. During this process, if we need any kind of like a questionnaire or data from the patient, we need to have an info consent form signed from the patient. However, since our machine learning model do mostly retrospective analysis, meaning that we go back to collect data from the clinical database and use the data to perform machine learning analysis. So this means that we will not intervene, or we will not change the treatment of a patient during the process. So usually it would take a shorter period of IRB review process compared to the clinical trial. Yeah. So yes, we also need to consider ethical issues and propose our IRB application properly. And after that, we can start to collect data from the clinical database. Yeah, back to you, Dr. Lori.
Okay, thank you, Professor Emily. Maybe there is still a question. Yeah. What measure can be taken to ensure transparency and explainability of the machine learning decision in health informatics system?
Thank you. It's a very important question, as what I just discussed. Nowadays, having a very high predictive performance in the research about medical informatics or health informatics is not only the only reason that we can consider. Having an explainable AI is also critical, especially in the interpretation of our findings. Therefore, we will use computational techniques. For example, we would like to examine what would be the variable importance ranking from our machine learning model. And besides that, of course, we will need to do a literature review to discuss whether our finding identified from our computational analysis correspond well with biomedical knowledge. So during this process, I think two parts are very important. First part, we need to make sure that our prediction model is reliable and our model can generate or can identify important features. In the second part, we still need to go back to do some literature review from the biomedical literature to make sure that our finding can be explained somehow from the aspect of biomedicine. Yeah, I think two parts are very important to make sure the explainability of our machine learning model. Thank you. Back to you, Dr. Rory.
Okay, maybe this is the last question for you, Professor Emily.
Thank you.
Please. Okay, this is the last question. What ethical dilemmas arise when using the machine learning to predict patient outcome, particularly regarding informed consent?
Oh yeah, I think it's a difficult question. Actually, during my presentation, we shared that the goal of doing health informatics related research is be able to propose useful suggestions or treatment suggestions for the patient in the clinical practice. So for this part, not only in Taiwan, but many places in the world, how reliable is an AI model so that we can apply the results predicted by machine learning model in the use of clinical practice. So actually, this field is considered as one of the medical material in Taiwan to help the patients. So in Taiwan, according to the regulation and the policy, we need to have our product made by AI to get the approval from FDA to be able to really use our prediction result from an AI model as a suggestion for the patient. Okay. So nowadays, I think a more application is related to the medical image analysis. Recently, a lot of startup company in Taiwan, they make use of machine learning technique to analyze medical image. For example, like automatic detection of the risk of interest from X-ray, from MRI, from CT, but our government need to make sure that this kind of application will not hurt the patient or cause other damage for the patient. Okay, so actually, I think this is a role that the government should help. They should set the clear regulation for the startup company to follow, and so that we can make sure the goal is to help patient in the clinical practice, but without providing any harm for them. Yeah, I think that's the answer for my first question. Back to you, Dr. Rory.
Okay, thank you, Professor Emily, for answering its question. And it's really great for all the participants who are so enthusiastic in this webinar. As a conclusion in the first and second session, we are pleased to highlight the transformative role of machine learning as a vital aspect of artificial intelligence, and in medical field, it facilitates the personalized medicine, is accurate the drug discovery, and in additional, the medicine learning is also detecting allergens, thereby improving patient safety and assess the factor influencing the IVF pregnancy success. This application is significant impact of the machine learning in revolutioning the healthcare and driving innovation. Ethical aspect that we should aware is the informed consent to the patient that should be clear and transparent, and make sure our machine learning is reliable and approved from the legal entity to make sure the privacy and the security data. Well, then we will move to the next presentation by the next speaker, Dr. Daniel Kriswinanto Adityo Nugroho, Master of Public Health, with the title Real Examples and Case Studies of Biomedical Informatics Application in Support of Public Health Policy. Dr. Daniel Kriswinanto Adityo Nugroho, Master of Public Health, completed his undergraduate and professional education at Gajah Mada Yogyakarta University. Then continue his master education, Master of Public Health at Gajah Mada Yogyakarta University, and now he is continuing his doctoral study at Taipei Medical University. His interest in research related to biomedical informatics, including telehealth, telemedicine, and electronic medical record. He is also active involved in various kind of research and training. Good afternoon, Dr. Daniel. How are you, Doc?
Good afternoon, Dr. Lori. It's nice to be here.
Yeah, it's really nice to see you here. Okay, good. Then, ladies and gentlemen, we will listen the second speaker on the day to Dr. Daniel Kriswinanto Adityo Nugroho, Master of Public Health. The time and screen is yours.
Yeah, good afternoon, everyone. Today I will continue the presentation from Professor Emily about biomedical informatics in public health. Today I will give some examples, especially on the definition and the recent advancement, and how about the future direction, especially in Indonesia. So for the definition, continuing from the biomedical informatics, as Professor Emily already explained, public health informatics is a branch of biomedical informatics which use a systematic application of information, computer science, and also technology to public health practice. So to give some context, usually public health practice is focused on promotive and preventive effort in healthcare service instead of curative and rehabilitative. So why is this topic is important? Because as we know, in Indonesia, healthcare quality is still imbalance, and we know the urban and rural area quality of healthcare is quite mismatched, and also it is important to improve efficiency and effectivity in healthcare service, because as we learn during COVID pandemics era, people realize that queuing too long or queuing in a crowded area is increasing the risk of getting another disease. So how we can improve the efficiency and effectivity in healthcare service, and also the main goal is to give the ubiquitous health. What is ubiquitous health? So ubiquitous health is healthcare for everyone, albeit of his race, his religion, his social economic status, everywhere, either it's in rural area, urban area, or as we know, the remote areas and small islands in Indonesia, and also every time, not only the healthcare is provided on the working hours, but also in 24 hours, and all of the healthcare service should be given in the similar quality. So and I will continue in the recent advancement in healthcare informatics. Some is already explained by Professor Emily. The first one is obviously telehealth. So to give some context, in Indonesia we already have several telehealth, but this is something new that I learned in during my study. That the telehealth service is already embedded with artificial intelligence tool. So the application used for telemedicine is completed with the self-diagnosis tool using AI. So when the result of the self assessment is high, then the AI will recommend to connect to the telemedicine service, and the payment is already integrated in the Taiwan National Health Insurance. So this is like a new method of telehealth, and also there are also this is quite recent. The telehealth is used for recovery following stroke. As we know, when people get stroke, they will lose some of their ability to move, losing their motoric ability, and they need to be trained so that the muscle function doesn't deteriorate. So in recent studies showed that even the patient doesn't need to go to the healthcare service. So as long as they equipped by the this one is like a prototype of glove, smart glove, and also a program using virtual reality. So the rehabilitation method is the patient just need to do some exercises shown in the on the screen. So in this section, show that the patient is like plucking the vegetables. So it has the similar outcome from this result. It has the similar outcome with if the patient go directly to the hospital. So with this method, people in distant areas from the hospital could directly access the rehabilitation. As for Indonesia itself, actually, this is something that I also wonders. Actually, we already have proper telehealth function. So you just need to have active National Health Insurance or BPJS Kesehatan, and you need to download the application from the BPJS Kesehatan and then log in, and there's a menu here shown here in the konsultasi dokter. That page is directly connect to your family doctors, your primary your FKTP, fasilitas kesehatan tingkat pertama. So you can directly chat the doctor. So, but from my personal evaluation from the many healthcare service that hasn't really active in this facility, and also some of the people and also fellow doctors hasn't aware of this method, so they prefers like private service, layanan swasta, telehealth swasta, layanan telehealth swasta. So yeah, actually by using this one, you did not have to pay because it is all covered. It is all covered by the BPJS Kesehatan. Next one is that the next advancement is using chatbot. So the special things about this chatbot, this is my senior research. So this chatbot is have embedded with the artificial empathy. So so you will when you chat the chatbot, it will give you feedbacks with ultimately the positive feedback. So it won't like give you cold message and okay or something, but the chatbot will reply with positive message. Okay, like wonderful. Hope you don't change your mind tomorrow and so on. So yeah. This is one of the examples using a chatbot for the personal diet. And the next one is for anxiety and depressive symptoms. So, okay, it's too small. So, for this is used 24 hours. So, when people having anxiety, and then when he or she had some high risk in suicide in his text, the system will alert the emergency department to immediately contact the client. So because as we know, suicide hotline sometimes didn't work for 24 hours, but if you use chatbot, the chatbot don't need to sleep, don't need to have lunch break or dinner break or so on. So yeah, this is one example of the use of the chatbot. As for Indonesia, yeah, there's still this is my research, my own search on Google Scholar with the keyword of chatbot and depression, resulting in 143 results. So it's still, yeah, not much. And as far as I know, there haven't any nationally implemented chatbot for especially on depression. Okay, the next one is machine learning for disease prediction. As Professor Emily already mentioned, we can predict disease even before the diseases happen. This is important because some people have higher risk to develop a disease compared with others, and also we can also predict complications of a chronic disease, like commonly used here is diabetes type 2. Because yeah, as we know, type 2 diabetes in Indonesia is quite high, and the burden of disease is also quite high. So we can predict whether this person has high risk of like retinopathy or ischemic stroke or dementia and several other disease, or even cancer. We can also predict cancer in population. So if someone has high risk of cancer, we can give him early warning. And the next one is for screening and diagnostic. Usually is like using image or recommending laboratory test, which one is the more appropriate one, or also the image recognition on radiologic image like X-ray or CT scan or MRI. It's already the very common one is like used in this section. And also for the drug development, yeah, Professor Emily also already mentioned that if we use artificial intelligence or machine learning in drug development, we can cut the time because it much simpler for the ethical clearance, and also we can cut the cost because we didn't need to try trying the drug in animals for multiple times, and then give failure. We evaluate, try a little bit modification, and try it again to the other animal, and so on. So we can cut the cost and time for the drug development. Also, this one is also to in Indonesia. There are several attempts to use local data, but as we know, the result is quite low because actually the open data for clinical data is in Indonesia is very limited. So we only able to use and this one, the left one on the screen is using BPJS Kesehatan, data BPJS Kesehatan. Mainly it's consists of administrative data instead of clinical data. So with such limitation, it's give moderate result. So it's quite good, but not the best one. Okay, and when researchers try to use clinical data and integrate it with another for this one is meteorological data, they will show excellent result. So yeah, we hope that we can conduct research with better data quality. So for the future directions, the potential challenges, the first one is, as we know, the digital divide in Indonesia is quite high. According to the APG, Asosiasi Penyelenggara Internet Indonesia, the internet user is 79.5% and predominantly occupied by Gen Z and millennials. Yeah, like we, like us. But the other generation, it's quite low, like Gen X, generation above us, and it's quite low. And the second one is the digital health literacy itself. It's also quite quite low. As my previous research on digital health literacy in adolescent, they quite confused with the information on the internet. Which one is the correct information? Which one is the appropriate application to use, and so on. So the first challenge is the digital divide, and also the second one is interoperability. As you know, there are like dozens of software developers in Indonesia, and sometimes they had different programs with resulting in different database. For example, I'm giving examples of how iOS, Android, and Windows is quite hard to interoperable. But recently, Indonesia already implement Fire and which result in Satu Sehat program. This is the early attempt of how to control the healthcare software in development in Indonesia, so that it's already standardized. So I cannot build my own with my own likings of system. So this is the second issue. The third one is the quality and the accuracy of the data itself. This happens to me actually when I try to use the administrative data by National Health Insurance. Sometimes, as we know, that the data sometimes it's the diagnosis is upcoded. So, like the first, usually the doctors will give correct diagnosis, but due to some reasons, yeah, I won't say it's fraud or something, but due to various reasons, the doctor will give improper, the doctor or the medical record person in medical record department will give note on the change the diagnosis, so it will slightly upward. So for for this example, it's when it's type 2 diabetes, no complication, and it's upcoded into with complication. And then if I want to make a prediction for ophthalmology complication, I will get a bad training set. So it will result in bad prediction model. So yeah, this is also a challenge. And also the third one is data silo. Okay, data silo is when every institution is keeping their own data and not allowing other people outside of the department to even touch the data. Okay, so this will result in the data is very specific, cannot be generalized. Okay, time's up. Just a little bit quick sneak peek, and the next one is high number of ideas like machine learning prediction, but there's very low compared by to the implementation. So what should we do? The government already give regular sandbox and also collaborative partnership. Either it's multidisciplinary, multi-center collaboration, and also multinational collaboration. Okay, perhaps that's all. Thank you. I will return it to Dr. Lori.
Thank you, Dr. Daniel, for delivering the material, and it's really inspired us all in this afternoon. Now we are moved to the discussion session for the second speaker. I remind you again to be able to submit question in the chat box, and please provide question with the format name, this institution, dash speaker, dash question. And let's see the question that already given. The first one is, if the AI application is used by the medical personnel to complete reports at the hospital, won't it make the employee will be lazy? Because they depend on the AI application. How to learn the AI application quickly, and can you share some tips? Thank you.
It's a nice question. Yeah. Yeah. As we know, so, people sometimes judge that technology makes someone lazy, but actually, technology is helping people to get him or her to be more productive. So if the workload of the employee is reduced by the AI, then the healthcare employees, either it's doctor or the nurse or the dietitians or the board of directors, they could do something more, or they could uh, they could give time for the patient, because when when the doctor should write one by one, write the medical record one by one, it took some times, and the doctor then reduced the examination time for the patient, and then it would be bad. So it I yeah, I'm a positive person, so I'm what is optimist that the technology won't make the doctors, the nurse, the dietitian to be lazy, but they could give more service to the patient. And how to learn AI application quickly? I need to ensure more which AI application. If you want to learn the technology, new technology, usually there will be various guidelines that is given by the developer. Otherwise, you could learn by yeah, I'm actually learning by the tutorials in YouTube. But the main mindset and the most important one is actually the mindset itself. So if you know that if you use AI, you could do various kinds of healthcare service, then it will automatically motivate you to learn more enthusiastically. So yeah, the main one is actually the mindset. Thank you.
Okay, we move to the next question. What role did biomedical informatics play in shaping public health policy related to chronic disease management? And please, can you show me a specific case that demonstrates how data-driven insight led to policy change or improvement in patient outcome?
Okay. Yeah. Thank you. So for chronic disease management, as I shown in the slide, so when someone has higher risk to develop a disease or a complication of a chronic disease, the doctors could educate the patient more specifically. So like you should for someone who has high risk in ischemic stroke, okay, so you should avoid taking high cholesterol, or the doctor should try to ask for cholesterol result first before and checking another stroke related factors when the doctor get the high risk patient. So, and another example is actually yeah, one of the controversial drugs. Perhaps you have already hear the issue from several years ago that ranitidine, you know ranitidine, right? The medication for the gastritis, chronic gastritis. The issue is like the long-term use of ranitidine will give you gastric cancer. So one of the research from the multinational collaboration in Southeast Asia Pacific network by Observational Health Data Science and Informatics group, they shown that in Asia Pacific actually ranitidine doesn't increase the risk of gastric cancer. So by using the multinational data that shown that, and actually ranitidine is okay for the patient. So the the level of evidence is higher because the previous results only shown in a small population compared to the network research. So that's some of the examples.
Okay, thank you, Dr. Daniel. And maybe next question. Okay, how did the implementation of the electronic health record, or EHRS, and health information exchange system contribute to improving public health outcomes and policy decision during the management of the COVID-19 pandemic.
Okay, okay, this one is specific for the pandemics, right? Okay, because some of the long-term effect of the COVID-19 pandemics is still undergo from the long-term research. I haven't read any long-term result, but from the previous study related to COVID, we know that the like effectivity of some drugs and also the vaccine development is much faster because, like, as we know, people sometimes wonder, whoa, COVID is blowing like in the middle of 2020, and then why do they can able to develop vaccine in such quick response, like to 6 months, and then the vaccine is here. So and that's the development of the vaccine itself. COVID-19 vaccine is actually a product of the use of machine learning in drug development, and in this case is in the vaccine development. So they developed the vaccine simulated using machine learning, and then they try they quickly use it on the clinical trials, the first clinical trial, second clinical trial, and then the third clinical trial before it released to the public. And also, because but that's also didn't actually what's it called, menjamin keamanan tetap, but but ensure the safety of the vaccine by itself. But the vaccine actually works because right now the COVID is like weekends, and now considered as less lethal compared to the Delta or Omicron phase. So okay, that's some of the examples of the health information exchange.
Okay, Professor Emily, are you still joining us?
Yes, sure.
Yeah, maybe you want to add some for answering this question about the electronic health records on COVID-19 pandemic.
Oh, okay. Yeah. Okay. So for the implementation of EHR and health information exchange system to improve public health outcome and policy decision during the management of COVID-19 pandemic. Oh, okay. So for this one, I think COVID-19 is like several years ago, and during COVID-19 or the next pandemic, of course, our government and many other government in different countries, they learned from the experience of COVID-19. For example, for the outbreak or during some kind of restriction. I remember in the first 1 or 2 years of COVID-19, if you have a fever, then although you want to see a doctor in the outpatient clinic in a hospital, then you need to do a PCR to get into the hospital. But for example, I think if the next time we have a pandemic similar to COVID-19, the government will respond quicker from this experience, including how to do telemedicine, for example. People may not need to get into the hospital to actually consult with a medical doctor. Maybe they can do it online, or for some kind of examination. Maybe we can do it outside the hospital and be able to use the EHR to pass our examination results to the hospital for a medical doctor to make a decision about our diagnosis or treatment. Yeah, I think several lessons already learned during this process. Yeah, the reason why I mentioned this is that 3 years ago, my son was diagnosed as a, immune disease called IBD. It's a colon inflammation disease. At that time, he need to go to the hospital and actually see a doctor, but he has a slight fever. So it takes like 2 weeks to be able to get into the hospital. First, he need to do a test, and then he need to do a PCR. But from this experience, I think our government already learned how to do that. So lessons already learned, and I think if we have a next COVID, then our government will all respond quicker from our past experience. Yeah, I don't know if this answers the question.
Okay, thank you, Prof. Emily. Maybe last question.
Okay, is this one also for me or for Dr. Daniel?
Yeah, the both of you.
Oh, both of you. Okay. So I will try first to answer this question. So could you provide specific examples or case studies that highlight the impact of these technologies on public health response strategies? Yeah, I think it's a very big question, and especially from the point of view of medical informatics. Uh, for example, it stems from my answer to the previous question. I think especially for the concern in the public health, I think maybe implementation of telehealth or telemedicine could be a very important direction or strategies, especially the next time we encounter pandemic such as COVID-19. Yeah, it would be a good example that we can make use of the applications that we learned from the experience of using health informatics to become a policy or even strategy to encounter future public health problems. Yeah, so it's a quick answer from my part.
Okay, thank you, Professor Emily. Maybe Dr. Daniel?
Yes, as for me, the one that I showed in my slide, the artificial intelligence approach for severe dengue early warning system is currently applied for the early warning system for dengue in Semarang. So that is one of the example of the implementation of artificial intelligence for the public health response strategies. So as we know, sometimes when it's uh, okay, I use Indonesian again. Masa pancaroba, masa pancaroba, or the alternating season between rainy and the sunny season. We know that sometimes rain falls in some areas, and then uh, that area that will have higher risk of uh, dengue. So using this artificial intelligence to dengue early warning system, the puskesmas or community healthcare center could strengthen their kesmas kesmas kesehatan masyarakat, their public health response in facing the dengue risk, such as increasing the people's awareness in that area, and then sharing the uh, the apate powder and so on. Okay, then Dr. Lori.
Yeah, okay. Thank you, Professor Emily and Dr. Daniel. Maybe we move to the next question. Yeah, this is the last question. How to check that the data we use to make prediction tools is accurate? Maybe Dr. Daniel could
Okay.
answer.
Okay. So yeah. The earliest step in data analysis is actually about the data cleaning. So we check the data one by one, whether it's already correct or not. Is there any missing values? Is there any outliers? Is there any improper filling in the data? That's the first step. And actually the data cleaning took almost more than 50% of the total of the machine learning itself. So it is important to check our data, but we cannot do anything. We cannot do anything if the data is inaccurate from the source. As I mentioned before, yeah, we cannot do anything about the national health insurance data. But if we know that, okay, if on the national health insurance data is the diagnosis is not accurate, then I try to use another data that is more accurate, like the primary data from the electronic health record and so on. So yeah, that's the how to make sure that the data is accurate.
Okay, maybe from Professor Emily, do you have any additional statement?
Oh yeah, I think Dr. Daniel, he answered the question pretty well. And according from our experience, when we analyze the data, firstly, besides the data pre-processing, data cleaning, we want to make sure that our data is not garbage in, garbage out. If we didn't collect an appropriate data, then we cannot get results as what we expected. But the other part I want to add is that, for example, like Dr. Daniel, he talked about we need to we may try different data sets. For example, if you want to discuss the effect of laboratory data, for example, like a blood biomarker would be the risk factor for different diseases. If you want to analyze the effect of laboratory data, you need to make sure that, for example, if you are using the national health insurance data, that database from Taiwan didn't include any lab data. So you need to make sure that you are using the right data to answer your research question. That's the most important part. To make sure that the data you collected can answer your hypothesis or your research question. That's the most important part. And the other part we also need to pay attention to is the amount of the data. If you want to work on machine learning or medical informatics related topic, the number of sample cannot be too less. For example, if I only got 10 patients, then it's probably not suitable to develop a reliable machine learning model. Yeah. So besides the quality, the quantity of the data is also important. Yeah. Back to you, Dr. Lowry.
Okay, thank you, Professor Emily and Dr. Daniel, for answering the question. And it's really great that all of the participants also enthusiastic in this third session. As a conclusion in the third session, at the previous material that we knew the basis of the health informatics and the development strategy like machine learning. And now we are given the example and the application of the biomedical informatics in supporting health policy, especially in Indonesia. There are several applications such as mobile JKN. Then we can use the in silico analysis to predict condition that what a patient should take or what patient should do. But there is a several challenge from the operating system, the person that using the AI, the dependency of the person of the artificial intelligence, and also the quality and the accuracy of the application, and also the data silo. But it's really a great knowledge for us as a doctor and health workers in this digital area. Thank you, Professor Emily and Dr. Daniel. Now we are moved to the at the end of the webinar session. We are pleased to announce that the winner of the door prize for the 3 best question, and the lucky winner are the first one is Masvia from RSUD Prabu Muli. The second one is Hendy from Yogyakarta. And the third one is Danang Raharjo from Sukoharjo. We please to the winner, please contact the committee to claim your prize. And before I conclude, I would like to make a few announcements. We are excited to announce that in the celebration of the 15th anniversary of DUTA WACANA, Christian University Faculty of Medicine, we are organizing a series of engaging seminars. On September 7, 2024, we will host a seminar in collaboration in the Department of Physiology titled Effective Stress Management Strategy Through Physical Exercise in Generation Z Adolescents. The seminar is aimed to explore innovative approach in stress management among the today youth through the integration of the physical exercise. Additionally, on the September 14, 2024, we will hold a scientific seminar focused on the theme Advanced Update in Diagnosis and Treatment of Gastritis and Gastroesophageal Reflux Disease or GERD. We are also hold a call of abstract for a competition aimed at medical student, young doctor, general practitioner, and specialists. The theme of the competition is gastritic and gastroesophageal reflux disease. We encourage all of interest participants to submit their abstract and contribute to ongoing discussion in this important area of the healthcare. And don't hesitate to follow our Instagram at HUTFK_UKDW. It doesn't feel like we have gone through about 2 hours together, and at the end of this afternoon webinar, we once again express our deep gratitude to all the extraordinary speaker in this afternoon, namely Professor Emily Chia Yusu and Dr. Daniel Kriswinanto Adityanugroho, Master of Public Health, for being to deliver extraordinary material. Not to forget, of course, our thanks also go to all the webinar participants in this morning for participating in the webinar with enthusiasm. We hope that this webinar will help you in understanding biomedical informatics to support public health advocacy. We deeply appreciate your active participation and look forward to seeing you at our next webinar. Thank you for your valuable contribution to our scientific community. Good afternoon.